Perry, I'm not sure if people know this, but you and I, we went to college together, and we were like we knew each other. We were acquaintances. We dated each other's roommates in various.
Yeah,
Correct.
correct.
Something like
Yes.
that. If you had told me at that time, like one day you and Francis Perry Wilson III will do a podcast about sexual disorder, like I would have told you were a crazy person. I did not have this on my bingo card.
Oh, that's funny because I, for the past 25 years have been thinking to myself, someday Emily and I are going to sit down, talk about sexual dysfunction together. But that's whatever, different strokes for different folks. No pun intended.
Strokes. It's totally right. So I'm excited and somewhat apprehensive to discuss this complicated and nuanced topic.
Do we need to say that although this isn't an explicit podcast, it is going to acknowledge the existence of sex and sexual function? And if you're listening with your kids, be aware of that.
Absolutely. This is probably not the episode for the car. It's Thursday, June 11th, 2026, and this is Wellness Actually. This week we're asking, what's the deal with hypoactive sexual desire disorder?
All right. We are back. We're asking, what's the deal with hypoactive sexual desire disorder? Okay, Emily, this is one of the topics, maybe not HSDD per se, but like sexual activity, sexual function in my age group, in my cohort, presumably in your cohort as well, is something a lot of people sort of allude to without really digging down on. There's a lot of sly comments, like sort of the boomer humor stuff that I hear about, my wife's got a headache, like that kind of thing. But no one ever really sits down and compares notes. I mean, I think fortunately, but it's that's sort of what we're here to do, because if something is a disorder and it's out there, people might naturally wonder, like, do I have it? What do I have it? And I think maybe the place to start before we talk about like a disorder of sexual function is, what is normal here? Like when we think about this, especially, for people our age, 40s, kids, that kind of thing, you actually have some really interesting data on this.
Yeah, so I want to start by I once did a really great podcast with Emily Nagoski, who is a writer who writes about sex, and I asked the question, what's a normal amount of sex? And she was like, that is the worst possible question. And I came to think that she was right, because of course, like, there is there's average. I can tell you in the data what is the average, but the word normal has this like connotation about what is appropriate or what you should do, and I think that's actually not very helpful in a place where people are going to vary in like what makes them happy. So I'm going to tell you the average, but I'm not going to tell you what's normal.
I think that is very well said. It doesn't imply that if you're less than the average or more than the average that you are per se abnormal or pathological, but right. Please.
Okay, so I got very interested in this question a couple of years ago because I talked to a lot of parents of young kids, and it comes up all the time, the question of, are people having sex and how much are they having? And it's a place where people just like to have data. So we did this big survey of parents, and people were I do a lot of surveys actually on my website, and this is by far the most popular. So I had 26,000 people to report their sexual.
It's pretty amazing.
Data.
It's pretty amazing. It's one of the largest studies of its type. Like, as I was looking through the literature too.
So, the answer is that for parents, at least, sex varies quite a lot with the age of the youngest kid. So in the data, for people with kids under a year, the like modal frequency was once to twice a month. For people with kids over 5 years, the mode was more like 1 to 2 times a week. There's a reasonable share of people who say that they never have sex or less than once a year. It's not very high, but it's certainly, for almost 10% basically for people with very small children. And there are a very small number of people, like less than 1%, even with older kids who say they have sex every day. So, you know, like we're kind of, if you ask what's the average, it's something in the range of twice a week to once a month.
I think one of the really interesting things that was in your data was this relationship with age of parents and age of kids. So what you found is that if you holding the age of kids steady, like statistically, the older the parents were, sort of the less frequently they would have sex, which kind of makes sense, right? You get older, like things happen. But then the older the kids are, the more often the parents would have sex. And of course, those are correlated because older parents tend to have older children and everything. So it's this really complex interplay between biology, which is as we get older, like the hormones that drive our sex drive decrease, and then like logistics, which is like as our kids get older, there's just more opportunity.
Do you think that's true? I mean, this is a different topic, but I feel like there are some ways in which having older children presents less opportunity.
Okay.
I mean, because then they could catch like it. Well, anyway. Okay.
Oh, no, I think this is a critical thing to discuss. And if any of my children are listening to this, please turn it off.
Turn it off.
Now. Go to bed. Right now. Go to bed. It's bedtime.
Go to bed. Sleep is important.
You have to stay in your room.
So one of the things I thought was interesting, which maybe sort of leads into the question of how we sort of pathologize this, is actually a pretty large share of people said that they were not having enough sex.
This was so fascinating.
Not as much as they would want to.
Right.
And so even the people who are having sex 1 to 2 times a week, about 40% of them said they were having somewhat too little or way too little sex. As you get to people who are having sex a few times a year, almost 100% of them say that's not enough. And this for me was actually a much more telling piece of the data than the frequency, because I think if you say, you know, we're having sex twice a year and that works for us, like that feels like enough, then it's great. It is more concerning when you have almost everyone saying, well, actually, I'd love to have more, but something else is happening that's getting in the way.
Yeah,
I obviously are more likely to say they're not having. Men would like to have more sex than women.
Oh yeah, when you stratify by sex, but many women in your survey, in fact, the majority are also saying, yes, I'd like to have more. So, you know, in theory, you've got these couples, right? Both members of the couple are like, you know, I really wish we would have more sex, and yet we don't.
Yeah. And I mean, it's interesting. I'll just say one more thing about this, which is that people left a lot of comments, like thousands and thousands of people left comments. And some of this is I'll just read this because I think it summarizes a little bit of how people often feel with little kids. It's not that the sex is bad or that I don't love my spouse as much. It's just that we're both so tired all the time that the sex is very bland and feels like something we do quickly just for basic maintenance while the kids are temporarily asleep. The best analogy I can think of is forcing yourself to eat because you know you should, even though you're not actually very hungry.
Okay, that's a little bleak.
It's bleak, but I think we should come back to it later because actually there is some stuff in the data suggesting that actually may not be a terrible approach to sex.
You're right.
In some cases. So that's probably a good place to move into what we actually mean when we say hypoactive sexual desire disorder.
Right. So let me start by saying we don't mean like everyone like sometimes isn't in the mood, right? Like that's normal. That's natural. It's not, you're not going to be there all the time. This is hypoactive sexual desire disorder is a clinical disorder. And because it's a clinical disorder, it now appears in the DSM-5. So the Diagnostic and Statistical Manual is the big book of psychological diagnoses. It's where you find like, oh, what criteria do you need to fulfill to have major depressive disorder or bipolar disorder or schizophrenia or anything? And as of the 5th edition, which is the most recent, HSDD was put in here, although in the DSM-5, they call it female sexual interest / arousal disorder. This actually engendered some controversy, which I'll get to in a second. But just to say it, in order to be diagnosed with this, you need to have decreased or absent 3 of the following things: interest in sexual activity, sexual erotic thoughts or fantasies, initiation of sexual activity or unreceptive to partners' attempts to initiate, sexual excitement or pleasure in almost all encounters, sexual interest / arousal to erotic cues, genital or non-genital sensations during sexual activity. It needs to be going on at least 5 months. It needs to not be better explained by something else, like a medical condition or medications you're taking or stress or the million other things that obviously can cause all these things. And here's the kicker: for all psychological disorders, it has to be causing you significant distress. You have to be upset about it.
So the piece of this that I find a little hard in diagnosis is all of these things are kind of in the abstract, but most of the time we're thinking about sexual behavior in the context of a relationship. Mm-hmm. And so there's actually maybe an important distinction between, like, am I interested in sexual activity or initiation from the person who I am have available, or am I interested at all, right? Like, I think there is an important distinction here, which is, would you like to have sex with someone, or would you like to have sex with the person that you can have sex with? And those things may not be the same. And in principle, that seems like quite an important distinction, because a sexual interest arousal disorder is not it's not a marriage problem. It's not like there's a partnership problem. It's supposed to be a thing about your sexual function, not about the other person, but it feels almost impossible to separate those.
Yeah. And as I said, there was some controversy about this in 2 parts. Number one, the DSM-5 links sexual interest and sexual arousal in the same disorder, which is really not the same thing. One is a physiologic thing, like arousal is a little clearer to document in a man because of penises and erections. Mm-hmm. And so men have an arousal disorder. Men can have impotence, and there's like a drug there are many now drugs to treat that. That's different than interest. And it's the same with women. And so the DSM did get some criticism for that, because those things are separable. There are women who are very interested in sex, but just physically don't become aroused in that way. Lumping these together doesn't seem necessarily appropriate. The other controversy is that you'll see some people arguing that hypoactive sexual desire disorder basically was created to sell drugs, by the pharmaceutical industry. And we'll get to what those drugs are, and they're FDA approved, and whether or not they work. But this is kind of a new thing. And I think it's important to tease out, as you say, like, whether this is truly something inside the woman with hypoactive sexual desire disorder, or if it is a result of external things, whether that's the relationship, whether that's the result of life stress, et cetera.
Yeah, I mean, this feels to me like, if you think about some of the symptoms we associate, say, with perimenopause or menopause, like vaginal dryness, it's like a very specific reason that you might not be, like, that you might have trouble having sex or not find it as pleasurable because of this particular symptom. And that is something that deserves treatment. It has various kinds of treatment, is totally different from interest, but is going to show up in some sense in the same way. Like, if you are not, if you're not going to enjoy this, you're not going to want to do it. But those things are not, those things are not the same. And so you almost want a diagnosis like, well, do you like watching porn? Like, if you watch the porn, like, how do you react to that? And it's separate from, do you want to do it yourself, or would you enjoy doing this yourself?
Yeah, absolutely. I mean, that's what one of the criteria of in the DSM-5 is, like, a difficulty or decreased or absent arousal to erotic cues. So it is clear that, like, this is supposed to be something, right, regardless of what you're watching, regardless whether you're reading, 50 Shades of Grey, or you're with a partner that you love, or you're with the partner that you hate, like, it's all the same, right? Yeah. Let's talk about distress, though.
So can I ask another thing about the diagnosis also, which is, are they looking for changes over time? So I think, there's so much variation of in just general interest in sex, I think, across the population. Mm-hmm. Some people have a higher taste for sex than others, just in general. I would have thought that we'd be looking here for things that are changes from your norm. Is that part of the diagnosis or not?
No, it's not. That's not in any of the criteria. It does have to be persistent for 5 months. But of course, if that has been your norm forever, that's your norm. And it has been persistent for more than 5 months. But again, it has to be causing distress. So they actually call out in the DSM-5, they call out asexual orientation. And as like, this is not hypoactive sexual desire disorder. So if you are asexual, if that's your sexual orientation and it's not causing you distress and you've been that way, then that's it. You don't have a disorder. That's just who you are. I think this distress thing though is the one I keep getting hung up on. And by the way, this appears in every like DSM-5. It's almost like for every diagnosis you can have psychologically, there's always like, and it is harming your everyday life or it's causing you distress or something. Same with like alcohol use disorder and everything. But when it comes to sex, there's other people involved often. And so, I do wonder how you tease out, like, this is causing me distress because, gosh, I wish I could get more interested and it's just a fun, zesty part of life that I'm not engaging in and I want that to change, versus it's causing me distress because my partner is upset with me. And like, how do you know the difference?
Yeah, I mean, there's a thing in the DSM about, this is not explained by relationship stress.
Yeah.
But it seems awfully difficult in the context, particularly of, long-term marriage and so on, for this to not be wrapped up in, disconnects between people and in relationship stress. I mean, this is a huge source of stress for many marriages. So I guess I worry with this diagnosis in general that we are pathologizing a set of issues which are really not at all about something physical and are just things we should be trying to address to make people happier. And we've gotten to, well, we're going to give you some drug for it.
Yeah. Well, that's much more profitable.
Totally.
Than just trying to make people happy.
Yeah, it's like so true.
You've alluded to the fact that there are baseline libido differences in people. And I think that's true and relatively well established, that like there's some kind of libidinal set point that people have. And yes, it changes over time and generally as you get older, well, at least post-puberty, as you get older, that sort of wanes, kind of differs between men and women. What that means, of course, is that in partnered relationships, there is the potential to have a discrepancy. And this is, again, where I kind of keep coming back to with HSDD is like, is it the discrepancy that's causing the problem or not? And so I was looking into this a little bit, into the data, and there's actually like a really rich body of literature about like assessing libidinal discrepancies in married couples of all genders and sexual orientations. And it's fairly robust. So let me tell you, I'll go through one of these from the Archives of Sexual Behavior in 2014, and I'm curious what you think here. So this is a study that looked at over 1,000 married couples. They assessed the desire, like they asked each member of the couple how often they would like to have sex, how often they were having sex. And I wonder if any of these findings are surprising. So 52% of females indicated the desired frequency was equal to the observed frequency. So they were like, we're at the right spot. 37% of males said that. Okay. 48% of husbands reported a higher desire reality score. So that's like they want more than what is happening than the wives did. 18% of wives reported higher than their husbands. Greater discrepancies between this were associated with lower relationship satisfaction, greater conflict, lower positive communication, all with sort of modest effect sizes. So how do you take this literature? I mean, this is both men and women actually saying that they could do more, but men wanted more than women.
I don't find either of these sort of any of this thing in this space surprising. I think exactly what they mean is, again, a little hard to tease out. So one issue that comes up all the time is the question of what direction is the causality. So is it that people have a discrepancy in their desire, and that's leading to relationship dissatisfaction, which is leading to more desirable discrepancies? Is it that they have relationship dissatisfaction, and that's leading to the discrepancy? And then when we think about the amount, the sort of desire for more, there's a glass half full, glass half empty, which kind of comes back to some of this discussion of, what happens with kids. Like a lot of what happens when people have children, I should say, which is that a lot of what people are saying when they talk about wanting to have more sex is almost like it's almost a positive frame. It's like, I wish I had more time for this. As opposed to like, I wish I were involved with someone else that I was more interested in having sex with. It's sort of like, I want to do this. When we do it, it's great. It's like just hard to find the time, but I'm like, but it's a positive, it's a positive statement. And that feels different than, I'm frustrated that my partner doesn't want to have sex with me as much as I want.
Yeah, I like thinking of it that way. And I think to some extent, even being able to communicate that between partners can be helpful, right? There's just like, hey, by the way, we're on the same page here. It's not always going to work. But it's still, the desire is still there, right? Because there's you mentioned that one of the comments that you got was someone talking about sex is just kind of like maintenance on a car, right? Just like something that, you got to do periodically to kind of keep things together. And I said that feels bleak, but the truth is some of the data, and maybe you can walk us through this, like suggests, before we get to drugs and stuff like that, that this is a strategy. Yeah.
So before I talk about the data, I want to read you this quote, which I love so much, from someone.
Yeah.
We're both so tired, but when we do it, we're always like, man, that's great. We should do that more.
I know.
Like, that made me very happy, because I think that is, for some set of people, that this is really about like, we're just, it's not a phase of life in which this is a thing we're doing as much as we would like. Of course, there are many other people who will say, I just don't want to do this anymore. It doesn't make me happy. So,
and of course, there's other things that we don't have time to do, that like I didn't get to go to the gym today. Like I wanted to, I didn't have time. There was too much other stuff going on. So this is not like exclusive to sex for people with kids. And
no, totally. People actually also say they want to talk to their spouse more. They
go on dates,
talk to them, or have sex with them. Either one. All right.
Sometimes
so
both at the same time. Got to multitask, people.
Multitask. All right. So there are a bunch of strategies that people have tried to use to like mitigate these issues, which have some, at least I would say, survey-based evidence that they work for some people. So one is communication. Talking about how you feel about things is almost always a good idea. And a very large share of people, more or less 100% of couples, say that having some communication about differences in sexual desire is helpful. This is why therapy is helpful. But another thing, perhaps almost as helpful as communication, is an activity people call have sex anyway, which is actually a core part of some marital counseling advice when people are struggling with this, which is just to say, just even though it's like eating your the starting of it may feel like eating your vegetables, like just put it on the schedule. Say twice a week, we're going to have sex on these times, and it's going to be on the schedule, and we're going to do it. Partly because for many people, you do it, you're like, oh, that was pretty fun. And there's a moment of connection, and then you kind of are reminded that this is an enjoyable activity. Have sex anyway.
Yeah. I mean, this is, you're quoting data. The numbers I'm looking at are pretty impressive. So you're quoting data from this study of 230 couples from the Archives of Sexual Behavior in 2020. And as you say, 0%, not a single couple said communication was unhelpful. Like every single couple said, you should talk about this. That's the number one thing. But coming in hot at number 2 of the coping strategies, with only 5% of couples saying it's not helpful, was this have sex anyway.
Have sex anyway. There are other things which seem to work, for some people. So engagement in another activity with the partner. So doing something else to try to connect with your partner. About 88% of people said that was
date night
helpful. Date
night.
Like that.
Yeah.
The other thing people say is, to do it by yourself, which this study refers to as engagement in activity alone, masturbate. And I will say 80% of couples here said that was useful. And I think part of it is, if really the issue is one person just wants more orgasms and the other person, it may be that the compromise is that they get to have some of them by themselves. Yeah. What is a thing that people found, almost no one found helpful, was doing nothing, disengagement. Yeah. Nobody likes that. So don't do nothing.
Don't do nothing. And this can be obviously something that's difficult to talk about, going back to communication in part. And it's not just because it's like, ooh, it's a taboo subject and whatever. Cause most people after they've been married for a while have talked about a lot of things, but in part it's because that also takes time, which we've already established we don't have a lot of. And so it's like, and by the way, let's cut out some extra time to talk about our sex lives and stuff like that is also something else that fills up the schedule, which I think can be, it's easy to put off, I guess, is maybe the way I also
think you're understating how difficult people find it to discuss, to discuss this with a partner, particularly if it wasn't something that you needed to discuss as much, but you when you, in earlier parts of relationships when there was more time and, people were, but as we get older, people's bodies change. They want different things. Like maybe they're feeling like the idea of bringing up, well, why aren't we doing this more? Like, is it because you aren't as excited about me? Or is it like, I think people this is hard. Talking about sex and talking about money are really hard, even with people that you love.
This is fair. And I think we're all afraid of opening a can of worms too, right? Totally. Like, what am I going to hear? And am I going to hear something I don't want to hear? Especially hard from people you love. So Emily, let me put on my pharmacill hat and say, like, talking is tough and takes time. How about you just pop a pill? How about that? You don't even have to do it. You don't even have to tell your partner.
Sounds amazing. I mean, look, it worked for me. Okay. I think part of the thing here is, this is all coming out of, again, like a very clear medical diagnosis, right? Erectile dysfunction is like a real thing.
Yep.
It's like a real physical thing. You need the penis to be a way. It's not the way. We came up with a system to make it the way that you need. Like that was like a solid, and they made just an absolute shit ton of money on that.
Yeah. Yeah. Banger drug.
That's a banger drug. It's one of our best drugs. Really one of our best drugs.
I think most people know this, but just to say that Viagra was originally developed for pulmonary hypertension. It's a vasodilator. And this was just a very pleasant side effect that the initial trials revealed as part of adverse event reporting. People were like, something's going on here. Pfizer was like, pivot.
Who cares
you,
about
pulmonary
the
hypertension?
Fuck you, lungs. Those are not important.
Yes. So, let's talk drugs. We have 2 FDA approved drugs for hypoactive sexual desire disorder, whatever that may be. One is flibanserin or Addy, which is taken.
Terrible. Why do they name them these things?
I don't know. It's a pill that is taken daily at bedtime. The mechanism, it's really interesting. Like, we don't know enough about sex and arousal and desire and the complexities of the human mind to actually know why a lot of these drugs work. So like this drug, flibanserin, is a partial serotonin agonist, which serotonin is important, but like we have SSRIs, which, have a well-described side effect of decreasing sexual interest. Like it's way too complicated to fully understand. One of the things I'm curious what you think, Emily, is in these trials, right? So if you're going to get a drug approved by the FDA, you have to say there's a disease that it treats. Okay, so all right, we've created hypoactive sexual desire disorder. It's a disease that it treats, and there's an outcome that we can show with statistical tests improves. And so these researchers and pharmaceutical companies had to come up with that outcome, something measurable that they could send back to the FDA and say, look, this thing increased. And the thing that they used in all the flibanserin trials was an outcome called satisfying sexual events. So a satisfying sexual event is a sexual event that could happen with or without a partner. It could happen with or without an orgasm. It could, anything that the woman taking the drug would define, but it had to be satisfying in however she wanted to define that. And the pivotal trial for flibanserin showed that the change in satisfying sexual events per month was 1.2 in the placebo group. So placebo effect, once again, rearing its beautiful head. One extra sexually satisfying event in the placebo group, two extra sexually satisfying events in the flibanserin group. Is that the correct outcome? Should this have been FDA approved?
I mean, it's very difficult to say what would be the right outcome. You could say how many times, there's a more direct thing, which is like, how many times did you engage in a sexual event, either alone or with a partner? My guess is that they didn't. The issue with that is that the placebo effects are like too strong, particularly if you start taking this drug and people are like, okay, now I'm taking this, I'm going to have more sex with my partner. My guess is the placebo effect is too big and that you don't get anything.
Right. It's like oysters, right? Which have no aphrodisiac effect actually, but like if you think they do, yeah.
So I can see why they didn't go with just counts and they went with something else, but it's sort of oddly defined. I mean, it's just an unfortunate aspect. Like, I guess you could go with something more science-y, which I would have been inclined towards if you really thought this worked, which was like, there are ways to like probe how much blood flow there is to the vagina, right? And so you could say, like, I'm going to put a probe in the vagina, I'm going to have people watch porn, and I'm going to see like whether this drug gets them more aroused in those settings. Like, I think that would have been an interesting alternative approach to this. It's a little more sciencey, a little less real world. You probably also get some placebo effects, but I suspect that you would get much more minimal effects. So this feels like, I don't know.
Yeah. I mean, these are effects. It's hard to know, like, it would,
is that
like,
important?
Is this important? Is this meaningful? Right? Like, is the argument?
The meta-analysis here is a half a satisfying sexual event per month. So it's like, I don't know, like every day I got to take this pill every day. And then like one half of one time every 30 days, like something good happens. I don't know. It feels like,
and I'll tell you, this pill is not entirely benign. It can cause significant hypotension, low blood pressure, and fainting. And I think 40% or so of women in the pivotal trial complained of nausea on this pill, which I don't know how that is compatible with having more sexually satisfying events, but here we are.
One half of the one day when you don't feel nauseous, you have, I don't
know. Like, okay, I'm not nauseous. Let's go.
Is there anything else? The ad campaign for this is, it's so pink. It's like the pinkest ad campaign I've ever seen. The little pink pill that everyone's talking about. It's so pink.
Yeah, so they really leaned into this being
it's not for men.
Female Viagra. So let's say you don't want to take a drug every day. The other FDA approved medication is called bremelanotide or Vyleesi. It is, Emily, a peptide.
Our favorite.
Yeah. So one of the few
part
FDA
of the Wolverine
approved,
stack.
It's not
in the Wolverine stack.
No, it would be the if we're going to stick with the X-Men, it would be like the Rogue or Jean Grey stack, I guess. Maybe the Jubilee stack.
I would the Jean Grey stack. That's solid. I like it.
Okay. Jean Grey stack. So this is a subcutaneous injection as needed. So the recommendation is take it 45 minutes beforehand. So maybe a more Viagra-ish.
More like Viagra.
Yeah, a little more like Viagra. It works by binding another brain receptor we don't fully understand called the alpha melanocortin receptor. They appear to modulate sexual behavior in mice. It also seems to do something in humans. The trials in this case looked at a survey was their outcome called the Female Sexual Function Index, and they used the desire score subscore of that index. So this is a survey asking like how's your sexual desire doing? And there was a significant increase in sexual desire by 0.3 points or so. And there's also less distress by a similar amount. These are very modest effect sizes, but at least it's taken as needed. I don't know.
There's no difference in sexually satisfying events. It makes 40% of people nauseous, and it causes you to tan. It
can make you a little tan. Yeah, that's right. It's a variant of you guys might have seen we talked about in the peptide episode. There's a peptide called melanotan, which literally like causes your melanocytes to make more melanin, and like you inject yourself and turn yourself tan. It's kind of crazy. And this is a related peptide, so it's not, you don't get quite as tan, but it is listed on the side effects. And tan people have more sex
for sure. 100%. Did you watch Baywatch or whatever? My read of let's talk about before we can like overview this. Like, I think the third thing that is testosterone, which we talked about in the testosterone episode, which probably does work. Actually, probably
not FDA approved for this,
but not FDA approved for this. But there are a bunch of trials that show kind of, I would say, comparable effects to the little pink, the Addy little pink pill. About one more satisfying event per month.
So. Yeah, testosterone clearly works. You can listen to the hormone replacement therapy episode to hear more about that. But those are the drug options. Again, if you don't want to talk about it,
think that you should talk about. Like, I find this space pretty hard to think about because it feels like I'm kind of with the people who were complaining that the DSM has, created a disease for a drug, because so much of what actually seems to be going on feels like it's just people are struggling through some things in their partnerships that they could do a better job communicating about, and telling them, if you just take this pill, it will fix your relationship problems, is misleading and not true, and probably will leave them in a worse position, having not improved their marriage and having one half of one additional sexually satisfying event per month, possibly alone.
Right. Yeah. All right, let's do it then. So, Emily, with that said, smash. This is the most appropriate smash or pass ever. Okay.
What am I smashing or passing? You got to be like a little more specific here.
Here's the rules. Like hypoactive sexual desire disorder as a I don't know, as a treatable condition, smash or pass?
Pass. I think this is something people should be talking more about with their partner if they have one. They should be thinking about it. I am passing on medical treatment options for it. But what I am smashing, if you are listening to this and you are thinking this is really resonating, what I am smashing is Emily Nagoski's book, Come Together, which is a really, really good book talking about some of these issues in relationships. And I would really, really recommend to people. Pass.
I am going to smash here. I think that we've done.
Men. Yeah, this is a gender difference.
I think we've done a bad job, like exploring female sexuality, understanding female sexuality, and I am cautious about too quickly attributing to like attributing everything to the environment, as opposed to acknowledging that there's the possibility that there are underlying biological things that could be addressed here. Like, I don't want to write that off. So I'm going to smash further research, but probably I would do testosterone before some of these other agents.
Amazing. All right, that's it for hypoactive sexual desire disorder.